I think there's some very good news that we're still seeing, especially when we look at the overall case curve here in Ontario, where you can see that flattening we started to see a couple weeks really has continued, and we still seem to be seeing cases, staying flat or even going down just a little bit. If we look in Niagara's case curve, it's very similar here, where again, it sort of flattened out and we've been staying flat, if anything, actually going down a little bit. So the worries that we were seeing a bad fourth wave about to start, I think have been paused temporarily. I do think that there's lots of risk as we go through the rest of the fall. As weather gets cooler, people spend more time indoors, they're going to socially interact more. That's going to start to push those cases back up. We're of course going to have some, big celebration type gatherings around Thanksgiving, Halloween. All of those are going to put risk that we're going to see cases go up. So I do think this is a bit of a temporary pause, but nonetheless, I think it's very good news for us right now that we are buying ourselves more time to get people vaccinated. We are able to keep things flat for the time being, and hopefully we can keep it, relatively controlled all through the winter as a result. Just showing you this graph again of, several of our other neighboring and similar sized regions across the province and where the case trends have been going. And you can really see when you look at this end, almost every part of the province right now is flat. And areas like Hamilton, which we're seeing very large numbers of cases, have really actually come down closer to where the rest of the regions are. So, I think all that is, good news. And of course, if we're looking at where the modeling was saying at the end of August we were headed, the thinking was we were on this line, and the worry was with people going back to school and workplaces, more social interaction might actually shift us onto this red line. We've of course seemed to have gone on to closer to something like this green line or very close to it, where near the end of September, we're still seeing provincial cases in the upper hundreds, but under 1,000. So, we're definitely, on the better track here than I think many of us hope we would be. One thing I'm very much looking for here is all of this was based on increased contacts with people over the fall. And the assumption was we'd have increased contacts. And it seems like we somehow may have ended up with people having fewer contacts, and hence we've ended up on this lower trajectory. That's probably because maybe with some of the warnings of where cases are going, people maybe pulled back some of their social activity, or at least people stopped having the kinds of social activities that would result in large amounts of spread, such as social gathering, parties, and the like, and really got into more of a fall, back to school, back to work mindset, where they're maybe not socializing quite as much. That's my best thought of why we've ended up on this lower trajectory. If we're taking a look at mobility, and this is the province's mobility data, we seem to be staying pretty flat right now if we're looking over the month of September. This black line is a measure of how restrictive COVID precautions have been in, and of course those have been pretty flat. We haven't really seen much change in our COVID precautions provincially. Looking sector by sector here in the province, it's relatively flat in places like retail, recreation. It does seem like we've trended to having a few more people out in workplaces, which does make a little bit of sense. More people are using transit. That's probably a reflection of more students using transit, more people going back to the workplace and using transit. But in terms of high-risk activities such as retail, recreation, low-risk activities such as staying home, we do seem to be staying pretty flat right now. Obviously, though, there's perhaps not that much lower we could go in terms of people staying home at this point. Looking at the Niagara mobility data, it's pretty similar here. Really since we've got into September, it's been fairly flat in terms of how much people are staying home. It's a bit noisy, so that I think confuses things a little bit, but we're definitely not seeing much of a trend in here. And in terms of shopping and recreation, of course, people have been out and about more than they've been at any time in the pandemic, but maybe there's been a little bit of a spike here. It's hard to say if that's just a short-term spike that'll drop back down. But it did seem like we are staying relatively flat and a bit lower than we were at the end of August. And that maybe does speak to maybe people, restricting some of their social activities as we headed back into September and people got back to school and work. Of course, ultimately, what we were worried about is hospitalizations. And we've seen in Alberta how hard they've been hit with hospitalizations when their cases went up. This is looking at the Ontario-wide trend. And you can see that as cases have flattened out and started to go down, eventually the hospitalizations have started to mirror that as well. And so that's very good news, of course, giving us more margin of error as we get into a higher risk period later this fall. And likewise, the ICU numbers look pretty flat there, as you can see. In Niagara, it's pretty similar story here. We're keeping hospitalizations pretty flat, a touch lower than they were maybe at the start of September. And then the ICU numbers likewise are pretty flat as well. Now, we of course want to try and keep this flat as long as we possibly can. We are, as I said, probably heading into months where the risk is going to grow, and it's going to be very difficult to keep cases under control as people start moving indoors, they socialize more. We have those big kinds of holiday weekends where people are going to socialize. I do see a lot of risk that our cases are going to start to go back up again. And so we're thinking very hard about what are some of the things we can do to control it. One big area where we are very focused right now is on education sectors. We saw schools very disrupted in the past year and a half due to COVID-19, and we're hoping to stave that off. I just want to show some quick stats of what we're seeing in terms of cases within the education sector. An education sector includes early childhood education, such as daycare. It includes kindergarten, grade school, as well as it includes our post-secondary students. And so we've seen about 1/8 of our cases this month have been linked to educational institutions. As a total number, that doesn't sound very large, but when there's a case in an educational institution, it's actually quite a lot of work because, of course, in a classroom, you are potentially infecting a very large number of people. So while it's only maybe 1/8 of our cases, I would say it's probably 2/3 of the work we're doing right now in public health is really following up with those cases to find who are the students at risk in school buses, in classrooms, and get them all isolated, get them tested, do all of our follow-up. It's actually a very large endeavor, and one big worry we have is that if cases go up higher in the community, cases in education institutions will probably follow because people studying in those institutions or working in those institutions are getting infected in the community and bringing into these institutions. So if cases go up in the community, they will go up there in the institutions as well. And that's going to create a huge workload for us in public health, which may be difficult for us to manage. And so we really want to try and keep these education cases as low as possible so that we can make sure we keep schools, childcare, universities open throughout this fall. Just to show you what that 12.5% of cases has actually meant, that's close to 100 cases. That's actually been 54 different educational institutions impacted. And a majority of those, I'll say, are actually our elementary schools. And of those 54 educational institutions, we've actually had 13 outbreaks amongst those institutions. And again, it's largely the younger ages who have been affected by those outbreaks. It is elementary schools, childcare who've been primarily where those outbreaks have occurred. To show you a little bit of a breakdown then of where those education cases are occurring by institution type, you can see very much, it shows exactly what I was just saying. It's overwhelmingly almost 2/3 are associated with elementary schools, and these are both students and staff, but associated with elementary schools. And then secondarily here with early childhood education. And I think it's pretty easy to guess why this might be. The students in these settings are the students who actually aren't eligible for vaccination for the most part. And so they're at greatest risk that when they're home, when they're in their out of school life, that they're going to be infected with COVID-19 and bring it into a school. And then once you're in a school or in a childcare, there's the greatest risk they could spread to others because all of the other people learning there are also likely to be unvaccinated again because they're of an age group where they just can't get vaccinated. Once we get into secondary schools, post-secondary schools, you can see there's far fewer cases linked with them. And I think that's really about the vaccine, the ability that, post-secondary students pretty much are all required to be vaccinated. Secondary students, they can all be vaccinated. They may not all be vaccinated, but a very large proportion of them have been. Just want to, look here a little bit more than about where the source of these education cases are. And I think a key thing to note here is students, staff who are bringing infection into an education institution, they are being infected primarily in their home, in the home of a contact. Secondarily, there is some spread occurring in educational institutions. And then we have these other family gatherings, social gatherings, parties, sports and recreation counting for a little bit. But most infection is actually coming from people's homes or a home of someone else that they have visited. A small bit is then, of course, the educational institution. And so a big priority to keep kids safe in schools, in childcare, is that we need to make sure everybody in the home is vaccinated, because that creates a protective cocoon for them, where they are unlikely to then to be infected and bring that infection into a school. When we take a look at our age groups of vaccinations here, we can see that obviously the school age children, they're one of the lower age groups, but actually our lowest age group is this 18 to 29 years of age group. These are, of course, adults, and you can imagine, the late 20s, that's probably the age of a lot of parents who have kids in childcare or kids in the early years of elementary school, and their vaccination rate is a bit lower, and that's not providing that protective, circle of protection around those children, which is possibly partly why we're seeing some of those cases showing up in educational institutions. So I think it's really important that any adults in this age group go and get vaccinated, especially if they have kids, especially if they're working in an educational institution, to make sure we keep those kids safe in those educational institutions. And of course, so far things are looking okay in our secondary schools, but the higher we can get this vaccination rate, the more safe we can ensure those schools are, especially when we get later into the fall and we may see higher cases in the community and more risk to the secondary students. Of course, similar message I think would apply to some of our 30-year-olds and 40-year-olds who may be parents of children. We obviously want to get them vaccinated as well to make sure that we keep schools safe. You can see overall, we continue to have really good success of getting our elder age groups very vaccinated. Sort of the more middle age groups are kind of in between, and it's really the youngest age groups where we've seen the slowest uptake, with particularly the 18 to 29 age group being the one that really is lagging all the others. We did hit a milestone this weekend where we now have 70% of Niagara residents fully vaccinated. And as you can see, we're getting very close to 80% of our eligible residents or adults fully vaccinated. And so, with 85% almost having got at least one dose, there's actually it's only about 15% of eligible people now who haven't at least started the process of getting vaccinated. So we are making good progress there. But schools are definitely a big priority, and people associated with school is a big priority to get vaccinated. The one other priority area that I want to talk about is, actually before I go on there, I just want to quickly show how our our infection rate in age groups really seems to track those vaccine uptake numbers. You can see here that if we look at our, age groups that are oldest, the 60 to 79-year age group, the 80+ age group, they are the lowest in terms of their infection rate. You can see in past waves, they were much more middle of the track, or even if you go back to the first wave, they actually were the highest, that blue and green line. They are now the lowest. And I think that's a direct consequence that this is the age group that has embraced vaccine the most quickly. And so we're not seeing the spread of infection amongst them during this wave. When we look at this gray line here, that is, of course, our 20 to 39 age group. The 20-year-olds, as I showed, are an age group that has the lowest vaccine uptake, and it's probably not surprising that they actually have the highest number of cases. And then, next below that is the under 20s. Those are school-age children, where unfortunately there's the second highest in terms of the cases we're seeing in the community. And so I think, very clear evidence here that the vaccine works. If you're vaccinated, your risk of infection falls quite drastically. When you're an age group that's unvaccinated, you're more likely to see cases in that age group. So continue to vaccinate that younger age group associated with schools or parents of school children or working in schools is really key. The other part is that if we take a look at where our outbreaks are occurring in Niagara, and this is, an updated graph, this is now looking at just September. I think you can see here very clearly that food services is an area where we're seeing a fair number of outbreaks. Second is here when it comes to the the workplaces, education sector would be there. But what I really want to zoom in is on this workplaces. And I'll say actually our food service outbreaks have basically all been workplace outbreaks as well. They've largely been spread amongst the employees with only minimal spread of infection to patrons. So when you look at that, about 30% of our outbreaks right now are actually in a workplace setting. And I think it's notable with food services, of course, you can imagine they tend to hire a lot of relatively younger workers. Younger workers are perhaps the ones who are less likely to be vaccinated. A pattern with all of our workplace outbreaks is that we are seeing unvaccinated workplace workers where the infection is spreading. And workplaces that have low vaccination rates are the ones where we see a lot of spread, and that includes our food service sectors. And so another priority for us is to try and tamp down on these workplace outbreaks where we think we can actually bring a slowdown to them if we got more workplaces vaccinated. Now, to keep workplaces safe, we have a few different strategies we want to do. Vaccination, as I mentioned, is the top one. And you saw a media release we released last week, really encouraging workplaces that it's important that they get vaccinated so we can stop those outbreaks. Of course, when there's an outbreak in our workplace, in addition to people getting infections spreading amongst them, it disrupts the workplace. You don't have your employees to stay operating or at least operating at normal capacity. If on the very unfortunate circumstance, one of your employees gets hospitalized, gets on a ventilator, perhaps ends up with long COVID and has persistent symptoms, that could mean you have some of your employees out of the workplace for a long period of time, and that can be very disruptive. And so we really think that for the safety community, but also just for the ability of a workplace to continue operating after 18 months of lots of disruption, it's really important workplaces look at having a vaccination policy to make sure that they keep their workplace safe and up and running. Now, after vaccination, the next most important thing, of course, is we want to prevent anybody who may get infected either because they're unvaccinated or the minority who are vaccinated who still end up with infection. We want to make sure we identify them early so we don't enter the workplace. And that's really about ensuring you have good daily screening. It remains a legal requirement that employees are screened for symptoms of illness before they come into the workplace to make sure they're not bringing infection in. That screening can be complemented by rapid testing. So someone has no symptoms of illness. Rapid testing could identify up to 40 to 50% of asymptomatic cases. It's not going to make a huge difference, but it could be a small difference. And the province of Ontario is allowing workplaces to access free rapid tests through chambers of commerce. And so that's something workplaces could think about in order to keep infections out. The other part, of course, if anybody does have symptoms, as a workplace, you want to facilitate them making sure they stay home. So make sure you have sick pay policies so people don't feel like they need to show up to the workplace, and make sure they get advised to go get tested so we can find out their COVID-19 case and start to do contact tracing and make sure we don't see any further spread from that. Of course, I mentioned there are asymptomatic cases that you're not going to catch on daily screening, and at least half of them are not going to be caught on even rapid testing if you do it. So you are invariably going to sadly sometimes have asymptomatic infections ending up in a workplace. Vaccination, of course, is going to prevent that. But aside from that, the one other thing you can do is make sure you set up your workplace to stop the spread of infection. And that means ensuring you have your ventilation system running so that any of these fine aerosols that are airborne are basically being exchanged out of the air into the outside and not concentrating in the workplace where they can infect people. Likewise, having at least a MERV 13 rated filter can make sure you start to filter some of those out as it's going through the HVAC system. Obviously, making sure people keep physical distance is really important. If you're 2 meters apart, these heavy droplets that can spread infection are much less likely to get to you. And wearing masks, of course, is really important so you don't breathe in these droplets or aerosols. And so if you are unfortunately the person infected, you're not going to be breathing them out. And in some workplaces where you can't keep physical distance, it is an expectation you also wear eye protection, such as goggles or a face shield. And likewise, if you're serving customers, you generally are required to have goggles or a face shield as well. And so I'd strongly encourage workplaces to be thinking about all of those. And we'll be doing additional messaging around some of these measures in the coming days to make sure we really make sure our workplaces are as safe as possible. So stop there with questions. Obviously, education sector workplaces are a big priority for us right now to make sure we slow down the spread of infection further and really keep cases at a manageable level as long as possible. So over to you, Meredith, for questions.
Okay, thanks, Dr. Hergy. So up first on my list, I see Gord Howard. Gord, do you have any questions?
I do. Good afternoon. I wonder, Dr. Hergy, with Niagara Health closing its vaccination clinic, and I only see 3 clinics scheduled on the public health website. Do you see public health possibly getting out and allowing just the pharmacies to do vaccinations anytime soon?
Oh, we have no intention of backing out of the vaccination business in public health right now. We're still seeing several hundred people every day in our vaccine clinics. I think we did, 300-400 yesterday. The previous day we're at 600-700. So we're seeing big numbers of people coming to our clinics to get vaccinated. And we think as long as people are coming to our clinics, that's really a priority for us to keep operating. We want to make sure we get people vaccinated as much as possible. The other thing that we are doing in public health, which I don't think would happen as much if we left vaccines just up to primary care and pharmacies, is some of those pop-up clinics, some of those outreach activities to get people vaccinated. I think that's really a unique niche that we are filling right now. So going to population areas where we know there's lower vaccine uptake, where there aren't primary care or pharmacies around, that's where we're targeting to do pop-up clinics to expand access to vaccination, as well as doing mobile vaccination, opportunities for underserved populations, going into long-term care homes, all of that. So I think there's a really important niche that we're filling. So we don't intend to back out of the vaccination business anytime soon.
And a follow-up, Gord?
Yeah, you'd mentioned also about the work it takes to follow up cases in schools.
Mm-hmm.
Are you able still to keep up on contact tracing as quickly as you'd like? And how many more cases in schools would it take before you really would have a hard time keeping up to the rate you'd like to maintain?
Yeah, so right now we are keeping up, and the worry is that if things did go up, as the second part of your question alludes, it could become more difficult. It's really hard to say exactly how many cases it would be. Every school case is a bit different. You can have a child who was driven by the parents to school. They went in a classroom. It's one class that's affected. You could have a child who was, rode the bus. So you have a bus affected. They're in a classroom that's affected. Maybe they're in some sort of after school activity, or they're part of an athletics team. That's a whole nother group who might be affected. You could have teachers, and teachers may be teaching multiple classes, and that could be actually multiple different groups. So it's hard to really say how many more cases we could really handle, just given how variable that is. I think the big concern is the more cases we get, the more and more difficult it is going to be to able to keep up. Partly what we can do is also we can start to progressively lessen the quality of our contact tracing, which allows us to do more quantity too. But at some point, that means you no longer have a good sense of what are the chains of transmission, and you're going to start to lose a handle on things. So, I think we have a little bit we could go higher, but, there's a lot of risk coming up in the fall, and we'd rather push this down as low as possible so we have as much margin of error going forward.
Okay, thanks, Gord. Paul Forsyth, over to you.
Can you hear me?
Yep.
Oh, great. So Dr. Hergy, you talked about the idea of, the numbers being fairly flat. Are you getting much sense on the vaccine passport, on the impact it's having? Is it driving more people? You mentioned you're getting several hundred people a day. Do you think the passport is driving some of that?
I think it is. We have a little bit of anecdotal evidence where there are people saying that they're coming to get vaccinated because of the vaccine certification requirement. We don't actually routinely ask the question, so we don't know for sure why everybody is necessarily coming, but I don't think it's a coincidence that over the last week where the certification came into place, we did see a bit of a surge in terms of people with booked appointments in our clinics and even larger numbers of walk-ins. And I think that's not a coincidence. That's probably with, certification approaching and then arriving. A lot of people who are maybe on the fence or a little bit complacent about getting that vaccine got the nudge to go out and get it.
You had a follow-up, Paul?
Yes, you had mentioned the importance of employers having a vaccination policy. I know Turkster Lumber, they brought in a policy, have a policy, and I think they sent 170 staff home on leave. And they're facing a lot of blowback now on Facebook. People calling for, for people to boycott them. Do you think that sets is that a dangerous thing to see? You think that could that dissuade other employers from also having their own policies in place?
I think it's probably best to ask employers. I doubt it's helpful to see a bit of a backlash when an employer does the right thing to protect their employees as well as protect their clients. Key thing though, I'd point out though, you know, I showed the stats where we have about 85% of adults have at least one dose of vaccine. 80% plus now are fully vaccinated. So to the extent there's a backlash, the vast majority of adults have already chosen to get vaccinated. So I think it's a small minority who's going to have that backlash. I suspect the vast majority who is vaccinated will have a lot of respect for a workplace taking that extra step to protect them, protect their workers. And I don't think employers are really going to see a lot of loss of business because of this.
Thanks, Paul. Penny Coles, you're up next.
Hi, Dr. Hergy, you said something that sort of surprised me. I think most workplaces, or certainly many workplaces, they have to have exceptions or exemptions for employees being double vaccinated, whether it's for religious reasons or health reasons, even though that might be a very, very small number. And what we typically see is those employers saying there would have to be regular testing, although they don't always say what regular means. And you mentioned that the rapid testing is only catches 40 to 50%. I thought that was quite effective. Could you explain that?
Yeah, so unfortunately, rapid testing is only going to pick up about 40 to 50% of cases. Now, if you do rapid testing routinely, say you're doing it every single day, that does increase it a little bit, because each time, you're going to maybe pick up half of the ones you missed the previous time. But there's a reason why our, assessment centers, if you're, have symptoms of illness, you're getting a PCR test rather than the rapid test, because the rapid tests aren't completely accurate. The PCR test is really a much better test. The challenge is, of course, it takes a couple of days to get back. So, rapid tests, I think we should be mindful, do have that inaccuracy, and they are going to miss cases. That being said, it's better than doing nothing. I think there's definitely some value to it. We just need to recognize that it's not going to be this panacea that if you're rapid testing, you've eliminated the risk of someone being a COVID case.
And do you have a follow-up, Penny?
Yes. Is that because it only detects for a very short period of time? Is that why if you do it daily, you'll have better results? Does it just have to be given at the right time to be accurate?
There is a little bit of that. Just near the start of your illness is usually when the ability of the test to detect is going to be most accurate. The other part, though, is just some of the random variability with testing. A lot of the time, doing a rapid test isn't going to be by the healthcare provider. It's often going to be by a non-healthcare provider taking the swab, and in many cases, you're taking the swab yourself, and so you may not be as good at getting that swab. But if you do it 2 or 3 times, you might do a better job on another attempt to get it. And so that's part of why you do have some of that. But some of it is just the nature of the virus itself. In the rapid test, by optimizing a test to get speed, you are sacrificing some of the accuracy.
Thanks, Penny. Next up, we have Don Mitchell.
Hello, Dr. Hergy. Thanks very much for taking my question. I just wanted to go back about a month ago, a little over a month ago, and you'd mentioned Hamilton was a concern in terms of their cases rising. I know it's all become flat now, and Niagara is starting to become flat, but there was a period there in mid-September where Niagara actually surpassed Hamilton in percent positivity per 100,000, where I believe it was the week of the 12th to the 18th, it was 3.72% to Hamilton's 3.2%. And you also, on the presentation that you just did, you had 37% of cases potentially coming from outside of Niagara. Can you elaborate on the surrounding regions and what kind of effect it's had on Niagara in terms of cases?
Yeah, I think the big areas that we've seen tend to impact Niagara is the Hamilton and then the GTA. There's a lot of, I think, travel within the Golden Horseshoe in Ontario, especially I think with Hamilton. And we've seen really in past waves where when cases go up in the GTA or they go up in Hamilton, it very soon actually spills over to cases going up for us. And I think partly why things have flattened out and maybe gone down a little bit in Niagara has really been that Hamilton has seen their cases come down over the last few weeks. And that's really meant that there's less pressure of pushing cases up here and allowed our cases to come down as well.
And do you have a follow-up, Don?
Yeah, my follow-up involves masking just at some Niagara schools. So we've had a few parents actually reach out to us, and they had concerns about some students not being masked in Niagara schools. And one of their concerns was really the opt-out form, where they didn't feel that it provided very much information on why their children couldn't be masked. All you had to do is check off, does your child have a condition? You check it off, and they don't have to wear a mask. So can you kind of tell me a little more about that situation, or whether you've heard that there had any concerns addressed to public health?
Yeah, we've definitely heard some concerns from parents around this, and actually the school boards as well have heard some of those concerns. And so we're actually in some discussion right now with the school boards talking about that and seeing other ways to maybe improve that and address some of the concerns of parents.
Okay, thanks, Don. And next we have Nicole from CHCH.
Hi, thank you so much for taking my question, Dr. Hirji. I'm just wondering, Toronto Public Health has just announced that they're gearing up to administer Pfizer for children age 5 to 11 as soon as it's approved. What preparations are being made in Niagara right now, and how many kids will be eligible?
Yeah, so the number of kids eligible, I believe, is around 32,500. I know that number because we absolutely are doing those preparations as well. We've mapped out lots of scenarios around, what would be the volumes that we would need to take in our clinics, depending on how much support there is from pharmacies, from primary care, and in order to get that full group of students vaccinated, or I shouldn't say students, children vaccinated. We've also been looking geographically of where do these actually students live. So where would it make the most sense to actually run some of our clinics? So we're absolutely doing lots of preparation on that front as well. We actually think that this could be a campaign that is on the order of, depending on the vaccine supplies there, 3 to 4 weeks, and we could actually get a first round done of all the children or who have parents who want them to be vaccinated. I think a big question for us is going to be if there are parents who maybe don't want to get their children vaccinated. I think, as I showed some of the stats in elementary schools, that they are being very much affected, and we hope that is going to be a motivator for parents. And so we are going to be doing some thinking around how do we make sure to message and motivate those parents when the vaccine's available. The other, I think, big hiccup here could be the availability of vaccine. So the Pfizer vaccine is actually going to be a special pediatric reformulation of the vaccine. It's not going to be the same vaccine we currently have in freezers. And so once it's approved, we're going to need to get a hold of that vaccine. I'm hoping it's going to be readily available, but it's quite possible that we won't be able to get a hold of very much initially. It might be similar to what we were seeing back in December, January, February, where there's constrained supply of vaccine, where Pfizer was just starting to produce the vaccine. The US was buying up a lot of it. Other countries had maybe had a preferential access, and Canada is a much smaller market, wasn't really first in line to get a hold of it. I'm hoping the production is going to be ramping up a lot more quickly, so there won't be those constraints, but I think that is one possible concern we may have, and that might end up being the right limiting factor of how quickly we can vaccinate that population.
Thank you
And
so
a follow-up,
much.
Nicole?
I do, thank you. And how severe is the illness for children in Niagara? What have you been seeing or hearing throughout the region?
Yeah, I don't have the numbers offhand here. Definitely we see that amongst children, the chances of severe illness are much less. That being said, we do definitely have a handful of children who have been hospitalized with COVID-19. And so it's absolutely not something you ever want to, knowingly keep your child with unnecessary risk to you and have that to occur. Not so much in Niagara, but you probably saw the news headline a couple weeks ago where in Waterloo region, they sadly had the death of a child under the age of 10. And, I think that speaks to where the, very minority, very small number, but the quite severe outcomes that can happen. Fortunately, most children are just going to get more like a cold-like illness, and it'll, of course, disrupt their ability to attend school or kindergarten. They'll be stuck at home. The other part, of course, is that if they're infected, is a very high risk of spread within the household. So anybody else in the home who is unvaccinated is going to be particularly at risk. If there's elderly people in the home, and we know elderly people often get the most severe illness, they're going to be also at risk. And so, I think we want to make sure we vaccinate children to protect them, to make sure they're able to attend school without disruption, but also make sure the whole family and the whole community is protected as well.
Okay, thanks, Nicole. So Richard has advised me he's just observing this week and doesn't have a question. So if anyone else has one more question they'd like to ask, can you just let me know in the chat and I will unmute you. Thanks. Okay, Gord, let me unmute you. There you go.
Thanks. You'd mentioned the opt-out option for the school boards. Are you talking to both boards or is it just the DSPN? And I wonder if you've got a rough number for how many parents or how many kids have been opted out of wearing masks.
Yeah, I don't have any statistics on the number of children who've opted out wearing masks. I think that's something you'd have to speak to the school board about. And we're speaking with both school boards. We always speak with both the school boards. The two school boards have taken a bit of a different approach around this. And we're talking about are there opportunities to maybe harmonize or at least, take learnings from one or the other and apply it elsewhere.
Thanks, Gord. And Nicole, you have one more question.
Thank you so much. Yes, with Thanksgiving coming up, what is your advice for attending family functions where some of the attendees are not vaccinated?
Very simply, my advice would be not to have unvaccinated people invited to those family events. I do worry, as I alluded, that Thanksgiving could lead to a lot of spread of infection when we have those big gatherings, and we may see a spike of infections coming out of that. That could mean vaccinated people who are around an infected, unvaccinated person will be at risk of becoming one of those breakthrough infections. That could lead to children having their school disrupted, people not being able to work or causing workplace outbreaks. I think it's safest when you can meet only with vaccinated people because that brings a risk of infection much lower. And I'd recommend that you really, aside from, of course, children under the age of 12 who can't get vaccinated or people with medical conditions, people who are choosing not to be vaccinated probably shouldn't be invited to those Thanksgiving gatherings to make sure you don't cause a risk for everybody else who's attending.
All right, thank you very much, everyone. So that looks like everyone's questions. If you do have any follow-ups after the session, feel free to email Courtney and me and we will get an answer for you. And we will see you again in a few weeks. Thank you.